Your x-rays were normal, but that doesn't mean you're fine. After a car accident collision, the most serious injuries often involve ligaments and soft tissue, structures that do not appear on standard imaging. In this video, I explain why whiplash injuries are frequently underestimated, the difference between muscle soreness and ligament instability, the specific physical tests I use to detect hidden damage, why untreated instability leads to chronic neck pain, and how a simple symptom can mean you suffered a concussion. Many patients feel okay immediately after an accident, only to develop worsening pain days later. I'll explain why. Before we dive in, please like and subscribe so this channel can continue to grow. Thank you. Okay, so you had an accident and immediately afterwards you noticed some neck and back stiffness, but not much pain. To be safe, you went to the emergency room to get checked. They looked you over and did a CAT scan of your head, chest, and neck because you had some tenderness in those areas. So far, everything is going to textbook protocol. After 5 hours in a crowded ER, the doctor comes back and says, CAT scans are normal, you look good, nothing broken, you can go home. She prescribes ibuprofen and a muscle relaxer and says follow up with your primary care provider if you're still sore in a week. Whew, what a relief. Looks like the only major damage was to your car. Fast forward 3 days. You wake up in the morning and wow, your neck feels like it's in a vise. It's all locked up and even the slightest of movements causes sharp pains to shoot from your neck to your shoulder blades. You take a hot shower and that seems to help a little. At least now you can turn your neck a little better. Getting dressed for work is a bit of a chore, but you manage and go to your car to commute to work. As soon as you turn your head and shoulders to grab your seatbelt, wham! Sharp shooting pains into the shoulder blades again. You drive to work and instead of turning your head, you figure out you have to turn your whole body to check the mirrors. Once at work, you're okay as long as you don't move. A coworker asks you a question about a recent project. For some reason, you're having a hard time remembering the name of the contact person on the account. After your coworker jogs your memory, you recall the name. Later, when you are analyzing data, the numbers are kind of swirling on the screen and you can't focus. After a couple of hours at work, you feel exhausted. You have a headache, and you keep getting tongue-tied when speaking with your colleagues. Before lunch, and you are already maxed out for the day, so you go home. You think a day of rest will help, and you'll be better tomorrow. Your alarm goes off, and just like in the movie Groundhog Day, your day starts off just like the day before. You can barely lift your head off the pillow. The hot shower helps a little bit, and you're on your way to work. You sit staring at your monitor trying to figure out what you did yesterday because your data makes no sense. Your office mate comes in and asks some questions, and you literally have no way to answer them. She repeats a few times, and you barely understand what she is asking. She looks at you and says, "You look terrible and seem off. What's wrong?" You explain you had a car accident a few days ago, but got checked and was fine, but the past 2 days you don't feel right. That's when she says, "The same thing happened to my sister Sarah. She had a crash and everything was fine, and then a week later she started getting spasms and headaches and couldn't concentrate. She found a specialist who said she had a whiplash and concussion that had been hidden. Maybe that's what's wrong with you, but my CAT scan was normal," you say, and she just nods and says, "That's what my sister said too." She then texted her sister and got the number to the specialist. "Call him. He fixed my sister. He might be able to help you too." Hi, I'm Dr. Barry Marks. I'm a chiropractor in Orange, California, specializing in whiplash and concussion injuries from car accidents. Since 1986, I have helped thousands of car accident victims recover. This scenario plays out every day. Accident victims are seemingly okay, and then days, even weeks later, they appear to suddenly have pain out of nowhere. This is more common than you might imagine. Let me explain what's going on. Whiplash injuries involve many tissues: muscles, ligaments, joint linings, tendons, discs, nerves, and your brain. Many people mistakenly think of whiplash as primarily a muscle injury. It's not. A very mild whiplash injury, what we call a grade 1 injury, is just a muscle strain. These injuries usually resolve quickly, but many car accident injuries are what's known as a grade 2 injury. These involve damage to ligaments. Whiplash injuries are frequently underestimated because the injuries don't necessarily show up on things like CAT scans and x-rays. You have to know exactly what you are looking for to sniff out hidden injuries. These are injuries that need time, like days or weeks, to become fully seen. The ER doc misses them because they haven't developed yet. It takes time for inflammation to show up and become symptomatic. Tissues like ligaments and your brain show symptoms slowly unless they are catastrophically injured. The first sign I look for to see if you have a hidden injury is neck stiffness. Early onset of neck stiffness tells me you most likely injured a ligament or disc, and your body is causing muscles to spasm as a protective measure so you won't make it worse. So if you tell me your neck or back were stiff soon after the crash, I'm testing your ligaments for damage. Ligaments are support structures that hold your bones together to form a joint. They are both strong and elastic. This allows your bones to stay together while you bend a joint, but don't allow the joint to move too far. When your ligaments become damaged, your joints have abnormal motion, which is something that I can find on my physical exam. I do specific maneuvers called orthopedic tests with your joints to see if you have ligament damage. I also take special x-rays with you bending to see if the joints are staying together as they should or if they're excessively moving. This is called ligamentous laxity. This is important to find because if ligaments remain too loose, your joints will move too much, putting stress on the joint. Eventually, your joints become arthritic much earlier than they should. Another hidden and often overlooked injury is a concussion. A concussion is an injury to your brain due to the rapid shaking of your head on impact. Let's be clear, you do not have to hit your head or lose consciousness to have a concussion. Concussions are microscopic injuries to nerve fibers in the brain that results in inflammation and malfunction. They do not show up on CAT scans or MRIs, but they do show up as signs and symptoms that are recognizable if you know what to look for. What are the early telltale signs I look for that tip me off that you have a concussion? Number one is headache, a mild lingering headache that seems to cover your whole head. It's worse in the morning and improves a little but stays with you all day. Next is being tongue-tied. That's when you can't seem to find the right word. The harder you try, the more difficult it is to remember. Along with that is often poor concentration, memory, and focus. Other early concussion signs can be unable to read or poor reading comprehension. Also feeling easily irritated, angry, or emotional. Once I see signs like this, I do specific brain and eye tests to see what part of your brain is malfunctioning. There are also questionnaires I will have you complete that assesses your brain's functioning. Whether it's a hidden ligament injury or a concussion, the most important thing is to get checked by a specialist who knows what to look for on day one. A doctor who knows what tests to do and what paperwork to use to document all of your injuries. Early evaluation can identify these injuries right away and prevent you from suffering more later. If you're in the Orange County, California area and need help with your car accident injury, go to drbarrymarks.com. There you can find more information about car accident, whiplash, and concussions. You can also find out how to make an appointment for an auto accident severity evaluation at no upfront cost to you.
Hey, how do I turn these off?